Well, good morning, everyone. We're actually happy to be here today. I'm Bob Ravenscroft, the Vice President for Advancement and CDO here at Bryan Health. Joining me today are familiar faces to all of you, Dr. John Trapp, who is our Chief Medical Officer, and John Woodrich, who is the Chief Executive Officer of Bryan Medical Center and the Executive Vice President for Bryan Health. We actually had thought about opening up this press conference playing Here Comes the Sun by the Beatles, but Jeff said we might be at risk for copyright violation and be blacked out, so we chose not to. We actually do have some really good news to share with you today. And I'll carry us through a few slides here to tell the story of where we've started, where we've been, where we're at right now, some key information that will be changing here at Bryan Medical Center in the near future. And then we'll turn it over to first John Woodrich and then Dr. John Trapp, and then open it up for questions. So if you see on this first slide here, for those members of the media that were with us way back in March and April of 2020, we put this graphic up here. And it was kind of crisis communication and crisis planning 101. And if you remember our physicians at that time, throughout those early months, they said we really wouldn't be getting into the resolution phase until we had vaccines. Well, what happened we all know, there was waiting lines, people jumping in line to get it, and then we kind of hit a pause in vaccinations. So we've been bouncing between that maintenance and resolution phase really since that time. One thing that we said at that time that was crucial in crisis communication was to be transparent, honest, open, empathetic, and very responsive. We have tried to do that, numerous media briefings pushing 150, countless individual interviews. And then one thing, the website at the bottom is the daily reporting of our stats that we have remained constant with since the beginning, even when data was harder to get from other parts of the state. So that's kind of where we started. Our pledge is to stay open and honest and transparent until we get completely through a resolution phase and begin evaluating what went right and what went wrong throughout this pandemic. This next slide is one that I know we're all very familiar with now. We've all heard about stop the spread, surge this, surge that. And we've seen these line charts that show these massive peaks and valleys. So if you're looking at the line chart, you'll see what happened prior to vaccines becoming available. Between those first variants and Delta, we really got down to almost no COVID cases in the hospital. Delta, you can see, starting in late July, early August, it was a steep rise. And then we really plateaued at very high censuses for a long time. As vaccines began to wane and we were really advocating for boosters, you see what has happened most recently over the past couple of months with Omicron. So that's the picture of where we've been really the past 2 years as it relates to hospitalized COVID care. There's been a lot of discussion and interest from the media and the community on overall hospital census. I can't tell you, and I know John and Dr. Trapp will probably share this later, how good it feels to be down around 500 instead of into the 540s and the 560s and even up into the 570s at one point over the last couple of months. Really, really encouraging news is we only have 40 COVID patients in our hospital right now in Bryan Medical Center. And only 25 of those are presently, contagious. There are still 15 individuals that remain hospitalized that have been here long enough where they're no longer infectious. But those numbers, and you can see the sharp decline that's occurring, is incredibly welcomed. As we take a quick peek back, again, I think this is important to see, kind of in different waves that were represented on that previous slide, you can kind of see where we've been from a resource consumption perspective. There's been so much interest in what's happening in the ICUs, and not every COVID patient was in an ICU, but they were sick enough to be hospitalized. But you can see, boy, in that initial wave, when things were pretty stressful, we had 30 patients and 10 ICU patients. One thing you'll see off to the side at that time, vaccines were not available. So 100% of our patients were unvaccinated. You fast forward to the first big surge of the fall of 2020, which was a very sobering time around here. Again, all of our patients were unvaccinated, and you can see that the ICU was, of the COVID patients, they were occupying about 16% of them were in intensive care. And boy, did last summer feel good. We got as low as our low point of having 3 COVID patients here. Still at that time, vaccines were available then, so what we were seeing is all unvaccinated patients. You come into this fall, boy, we hoped we would never have to do one of these briefings again, and then Delta arrived, and we had that pretty rapid rise at the end of the summer. And at that time, you were starting to see a few breakthroughs as the vaccine waned a little bit. 80% of our overall patients were unvaccinated, and 100% of the critically ill ones remained unvaccinated. You go to just a couple of weeks ago, when things were really peaking here again. During that process, we were recommending boosters because they were providing tremendous support against the newest variant. The double, what was previously fully boosted, not as much. And you could see we were about 50-50 of patients being vaccinated versus unvaccinated, but 81% of our critically ill patients were unvaccinated still. And here's where we are today. It's telling a similar story. You're still seeing some breakthroughs. That's why there's such a strong urge to get the booster. Real quickly, I'll go through a few other points before I turn it over to them. There were a lot of ups and downs throughout this process. I know this is an incomplete list, but there's still great pride in this organization that we stood up the first drive-through clinic when testing and finding out what the virus was doing in our community and in our state was so important. It's a great moment of pride. The unforgettable community support we received is still humbling to this day. It came in the form of finances, in the form of goods and services. I think what can't be lost through all of this is we've treated over 3,200 patients from across the state and bordering states. A third of these patients we've treated have been from outside of Lancaster County, and we're proud that we were able to respond for the state and the region. As treatment advancements came around, really in the last several months, half of this year, just an incredible amount of monoclonal infusions that took place here that really prevented additional resource strain on the hospital. There were downs through this. They're pretty well documented by now, but it kind of eats at us every day still that we lost 475 patients. And you can kind of see where that went through the waves. This fall has been tremendously hard still, especially when, it was coming from 3 patients all the way up to that to lose almost 200 patients since August 1 is hard. It was very difficult, as everyone's aware, to battle the constant misinformation. Yes, there were verbal and physical assaults on our staff from people who didn't want to comply with measures. Those things will stick with us forever. Lots of workforce challenges around resiliency. It's been well documented, the staffing agency issue, and then illness from our staff. As we were getting breakthroughs on our staff, our staff started getting ill. Now, what I think is really a testament to some of the preventative and layered protections, and maybe Dr. Trapp will share some information on this, we really had no workforce breakouts because we were universally masking since April of 2020. They proved very effective. Now, our staff was getting ill when they were out living their life in the community or being brought home from family members or children. Presented some unique challenges late in the year. We've received a couple of questions lately because of the vaccination requirements, which we have to comply with as an organization that receives Medicare and Medicaid funding. We now have 6,300 employees. That includes the 750 that recently joined our team from Kearney Regional Medical Center. Across our system, we began universal masking in April of 2020. Again, the workforce spread was pretty non-existent. As far as the requirements and compliance that we've been getting questions on, over 99% of our team is in full compliance. I think the message here is vaccines are not controversial in a healthcare setting. At the present time, we only have 12 employees that have not complied, and retaining their employment is in jeopardy at the moment. Now, I would say that there are a couple of them that are on maternity leave and intend to comply as soon as they return. So that's where the numbers here at Bryan. There's about 4.5% of our employees that have filed and had an approved religious or medical exemption, but extraordinary vaccination rates, and I hope that gives the community confidence. Now, here's where some really good news starts to get shared. This is all putting us in a position to relax some of the precautions we've had in place for a long time. So beginning on March 1, thankfully, maybe one of the hardest things was the restriction of family members to care, to be alongside their loved one when they were receiving care. We will be removing the 2 visitor restriction on March 1st. Dr. Trapp and John might share on how important that is to the care continuum for families. We're really happy to bring our valet services back to help patients, that might have ambulatory issues when they arrive at one of our campuses, and those will resume on March 7th of the next month. A positive sign, and I don't know if this gives anyone in the business community any motivation or reassurances, we are going to be asking all of our employees that are currently working remote, as the latest surge occurred, to return to the office on February 27th. Now, we have a high degree of confidence in that because we do still practice universal masking here. A really big one that certainly this past fall was very well covered. We are resuming surgeries with overnight stay. They have resumed, and that is accelerating. A couple of things that are important of what won't change, at least for the foreseeable future, masks will still be required in all of our facilities, and it's really twofold. There's still uncomfortable community spread out there despite the declining numbers for COVID, but also it's influenza season, and the first quarter of a calendar year is usually the high points. Our team doesn't need to get sick. They don't need any more time off. They don't need any additional kind of stresses in their life. We need them healthy and working. You need them healthy and working. So it's another reason, and you can see what's going on with influenza when more members of the population have been practicing masking and other precautionary measures. What will not change is we will continue to make our information available on a daily basis on the dashboard, and we will continue doing that until, as we kind of move into an endemic phase, it trickles down to, we'll keep it, I guess what we're saying is we will keep it available as long as the information is helpful to the public and the media. And what isn't changing, and I think I referenced this sooner, is our overwhelming gratitude for the support from this community and our local media. I know I've said it before, we would be in a much different spot if our local media wouldn't have been so attentive to this. And I know we all saw the articles a couple of weeks ago where they kind of stacked communities up and their COVID response, and we'd like to think we had some role in it. I think the local media deserves a big hand in having Lincoln rate so highly on how they navigated the pandemic. I've said enough. Those are the important statistical information for whatever stories you may produce out of this, but I'm going to bring first John Woodridge and then Dr. Trapp up to share some insights, and then we'll open it up for question and answers. Thank you very much.
Thanks, Bob. I just want to echo our appreciation to the media and actually our entire community, but most importantly to our medical staff, to our employees who've been unwavering, very dedicated, committed over these past couple of years. I want to thank our health department, working alongside of all the healthcare facilities, seeing everybody come together to do what's best to support our community. It was just a dynamic that we're so proud of what people have done. We know the pandemic's not over, but we are seeing some great signs. And you heard a few things that we're going to start to open up and try to get some normalcy back into our lives. It was nice to close one of our COVID dedicated units yesterday on our East Campus. We have a partial unit still left on our West Campus, but you could even feel it within our staff, and they're starting to see that light at the end of the tunnel, and the stress, you literally can kind of watch it come out of their faces, and it's just some really good signs. We felt really bad that we've had to hold off these elective surgeries for such a long period of time, but with the large volumes we have had, it was required. Now we're starting to open those back up. So we have a plan on what type of surgeries, the ones that just have a single night stay. And as those volumes continue to go down of COVID patients, we can open up more beds for surgical patients. And we're working right alongside of our surgeons and our medical staff, and they're helping us make these decisions. So we do it in a systemized fashion. And we are looking at those folks that are either most at risk or really can't wait any longer to have those elective surgeries done. So we'll continue to work with everyone on that. I just want to say, we look very forward to our employees being able to come back. It is something about missing their faces, their laughter, their networking, their skill sets, and that's just how we work. That's the culture of Bryan. And we really want to see that come back. And as Bob mentioned too, allowing the visitation to now open up again, I got to tell you, that was just gut-wrenching to watch happen every day. So we're really pleased that we're at that stage now, that we're able to do this and get things back to normal. But we're still very cautious in doing this, but we want to do it in a systematic fashion. With that, I thank you as a community. Again, thank the media for all their coverage as well. And I'm going to turn it over to Dr. Trapp.
Wow, what a journey we've been on over the last 2 years. Lots of challenges, lots of sorrow, sadness, but also lots of successes. I think about the different waves Bob so nicely outlined on the data he presented. With the first wave, so many unknowns went on into that first wave of the pandemic. We really, as providers, overwhelmed, really had very few treatment options, a lot of fear within our communities. We were trying to better understand this new virus that came upon this world. Then we were able to use technology throughout the country to develop vaccines, which we found to be very safe and effective. And then we were able to roll out those vaccines in many different ways through unique clinics throughout the community, through vaccination clinics here at Bryan, and we could see that sense of fear going away. Within our own providers, the comfort level of taking care of more COVID patients certainly increased as we were able to vaccinate our own providers. Then, of course, came that second wave, that Delta wave, and that was last fall, very, very difficult as patients became exceptionally sick with the virus, particularly affecting our unvaccinated patients, our immunocompromised patients, high ICU counts, increased death rates. Very difficult time. Each time that we've gone through a wave, we've looked to see if we could see light at the end of the tunnel. After the Delta wave, we thought we were seeing improvement, and then along comes Omicron, and here we go again with a variant that spreads more quickly. What we just didn't know was how much illness this would cause. Actually would cause increased illness even among our vaccinated. Fortunately, it didn't cause severe illness, but nevertheless took people away from our workforce. I would say over the last 10 days, we've seen really improvement in our hospitalization numbers. That's been great to see. We've seen staff being able to return to work. I look at the different nursing units, and I'm able to see those fully staffed at times. Fantastic. We've seen decreased number of COVID patients in our hospital, people getting better. In my own clinic, I've been able to see patients who have recovered from this virus and are so appreciative of the efforts of the healthcare system and providing them care and helping them to navigate this pandemic. Throughout all of this, pandemic, what do we come away with this? And hopefully we come away with this with, some wisdom. You say, what is wisdom? It really is the culmination of our past experiences over the last 2 years. And these include some of our successes, but probably most importantly, some of our failures. And through this culmination, we learn and we gain new knowledge. What's most important looking forward is how we apply this learning and new knowledge in our next steps. And we apply this in many ways. We apply this through our words and through our thoughts and through our actions. And as a health system, we hope to continue to do that. We hope to be a source of truth and knowledge and information for our community and through our state. What are the next steps that we're going to recommend to people? Questions have been asked about masking. Within our own organization, within the healthcare system, we're going to continue to mask within our walls. We know that that's helpful in preventing the spread of viruses, not only related to COVID, but other types of viruses, including influenza and RSV. We're going to continue to recommend appropriate social distancing and decreasing our risk where it makes sense. We're going to promote vaccination. We know that that's still really important for both COVID as well as other types of infections and viruses. Vaccination is a key part of our success. So if you've not been vaccinated, get vaccinated. If you haven't been boosted, get boosted. These are some of the next steps that help us to move forward and turn a pandemic into an endemic phase. What does that mean? That means we're going to need to learn to live with this virus in some way. We're going to see clusters of this looking forward. We anticipate we're going to have a number of patients in our hospital affected by this virus. But what it also means is that with those decreased numbers, we're going to be able to return to some level of new normal or normalcy. Being able to see other patients with complex diseases, accept more transfers from our outlying hospitals. We're going to be able to do more surgeries, some of these that don't require emergency or urgent nature, to get people taken care of and to get them back on paths of healthiness. The other things we've learned through this pandemic is how to partner. Partner within our own physicians, partner within our communities, partner with you, our media, partner with other healthcare entities throughout the state. This has been really a transformational time, and we hope to continue to be adaptive, innovative, organized, and transparent in what we do. So we're looking forward to the next steps on how we emerge from this pandemic as we anticipate this is heading towards a close and towards that endemic state. But we've come a long ways, and hopefully through all of this, we've gained some wisdom. So thank you.
As we wait for questions to come in, there was an advance question, and it was around the endemic phase, Dr. Trapp. As we go into that, what is kind of, and maybe John, you too, a comfortable number of where we can manage without pulling back on surgeries again, and if you go above that, from our learnings, will it trigger some of the safety measures like masking and distancing again?
Challenging questions. I wish we had that crystal ball to know exactly what's going to happen down the line. What's a comfortable number? Boy, 0 is a great number that I always would strive towards. We're going to manage this like other disease states. We've seen other disease states, influenza that have come and gone, even severe cases of influenza. We've seen RSV. We've seen other illnesses in our community that we're able to manage. Again, we've learned a lot from this past 2 years, and I look forward that we're going to continue to manage this with improved resources, the ability to vaccinate, additional treatments, knowledge, partnerships that we're going to be able to manage this with. If something were to come up, a new unusual variant or something else, we're going to have to learn to adapt and make those decisions at that point of time of what we need to do to make sure that we can provide the best safety for our community. So I don't know that I can give you a hard number of cases in the hospital. As you've seen during this pandemic, things have moved to and fro, and we've had to be, again, very adaptive in changing our strategies to meet the need. So we'll continue to do that moving forward as an organization. We'll continue to communicate with our physicians, our staff, our community on what the appropriate next steps are to keep the community safe. If we can maintain numbers of where they're at now, this is much more comfortable and allows us, as has been outlined, to increase our visitation, to increase the number of surgeries that we can do. One important thing about visitation, how important that is, having support people, families come to be with their loved ones who are hospitalized, how that promotes communication, how that promotes continuity of care, discharge planning, understanding of what's going on. That can't be undervalued. So really excited to get families and support people back into the hospital to enhance that communication. We know how important that is for each of you, but it's also very important for us. So looking forward to those next steps. I don't know if I've answered the question of how do we transition to a endemic stage, but we're going to manage this, and we're going to look at the numbers over time and look at what are appropriate next steps. Do I answer the next one?
Yeah, go ahead, and then we'll.
So the next question is Bryan experiencing any supply issues, especially with monoclonal antibodies and antivirals, et cetera? You know, the answer is certainly 10 days ago, the answer was very much yes. So sotrovimab, which is our monoclonal antibody that we've continued to provide through our clinic. This is an infusion therapy. We get about 24 doses a week. We do utilize all of those doses each week. With the decreasing numbers, we'll see if we have increased surplus of those antibody therapies. There also are new antibody therapies coming down the pipe that we may have access to. We still have our oral therapies, the molnupiravir, the Paxlovid, that are being underutilized in the community. Again, as we see numbers going down, we may see surplus of those therapies. I want to emphasize, those are therapies that once you're sick can help to minimize that risk for progressing to severe disease. But the important thing is we've got lots of vaccines available. So again, if I want to prioritize these therapies, vaccination is my number 1 preventative strategy for that. So the next question, has the hospital's decompression program been helpful? And if so, in what way? I'm happy to make my first stab on that one. Incredibly helpful. We were able to partner with the state and DHHS to see a facility developed that has 16 staff beds. We've been able to utilize those right away. So once upon opening, we were able to transition a number of patients there. I believe we have 12 or 13 patients there as of today. You wouldn't think that 10 or 12 patients would make a big difference, but it makes an incredible difference in our throughput and what beds we can open. I believe one of these patients had been here over 200 days, so the fact that we were able to get that patient placed, that opens up a bed. Every 3 or 4 days, our average length of stay is right around that 3 to 4 day mark. So if you just think about a new patient filling a bed every 3 to 4 days, this really does provide advantage for a number of patients over several weeks. Allows us to accept more transfers, allows us to open up more surgeries. It's a tremendous outlet and again, provides support to our staff who have been overworked at times and understaffed. It allows us to have a right level of patients for the number of staff that we have.
There's a question, what are the new visitation protocols and limitations? Essentially, we are going back to pre-pandemic levels. Recently, we've had a 2 visitor per day limit in place for patients, and it is going to be essentially open to any family member that wants to and has a need to see a patient. As far as protocols in place, those visitors will be expected to mask while they're in here. Again, we've learned so much from source control. I know there's a lot of chatter out there about if they're effective or not, but any spread and it's only been a handful of spread to patients through our contact tracing, we brought that back to it has been members of their family bringing it in because there have just not been those clusters or staff that interacted with them that were positive. So we are opening to pre-pandemic levels, but visitors visiting their loved ones will need to be masked when they're in our facilities. Yep.
So just one clarification on Bob's statement. For non-COVID patients, open visitation policy. Still for our COVID patients, because of the risk for infection and risk of exposure, we have set some limitations for active COVID positive patients. We are still restricting that visitation just to minimize risk and exposure. If you are a family member of someone who is here hospitalized with COVID and who is considered actively infectious and in isolation, work with the nursing staff and the providers to arrange a time and opportunity for what we call compassionate visits, where it's really important to convey that communication. We still do a number of these compassionate visits for families to enhance communication, and in some cases for end-of-life visits. So thanks.
John mentioned closing a COVID unit. What type of COVID patient capacity is available in Lincoln?
Well, that's, you heard Dr. Trapp talk about adapting. We've just continued to open up more COVID units when the demand caused that to happen. We've seen a spike up to as high as 114 in the last, 2 to 3 weeks. Back, I think it was at November of 20, I think we had seen up to 160 some patients. So that's where you just have to have the capability to adapt, convert units, change the airflow systems to create isolation rooms. That's some of the learnings that we have of how quickly we can do that when the need arises. But then that also limits people from getting care for routine things, or like you hear of elective surgeries. It's all about the capacity you have in your organization, the staffing that you have to take care of the folks. But we just continue to adapt as the needs in the community change.
John brought up a good point. It's physical capacity and staffing capacity, and as you know that have followed it, we've been operating at both physical and staffing capacities here at Bryan, throughout the duration of this. But it's time to put in a plug that for those that are interested in careers in healthcare or supporting students in healthcare, the state is projecting about a 5,200 shortage in nurses up until 2025. So there has been some issues that have come out of this from a resiliency standpoint and a change of career standpoint, and those are going to be some of the longer term impacts of this past 2 years, is how to rebuild the healthcare workforce. And boy, everybody in the community is struggling with workforce. So we have a lot of work to do, as a society on both of those fronts, and as a state and as a city, to attract people to Lincoln and to wonderful careers in healthcare. All right. I'll give it 2 more seconds here before we wrap up. It looks like it's winding down. You're getting good news from the community, from the state, from the nation, as you're seeing things relax. I don't think we're here to declare the pandemic is over, but we've learned, you know what to do to protect yourself in certain situations, and I think this is a testament to our comfort level of regaining some normalcy inside of our facility, and hopefully that provides the community additional comfort for how they can re-engage in certain ways. There is no shame in wearing this if you're in a protected health category. It would be highly recommended. I think the team would say that if there are heavily packed internal environments, you got to put your own internal filter on that and determine what is safe for you, because the case counts are still pretty dang high in the community. I mean, we were joking the other day about, if you think back to May of 2020, of what everybody was saying from state leadership on down, the case rates to cause concern are significantly lower than what they are now. So that's what we've learned as we've learned to live with it. But the point there is it's still an active virus, but the signs are very, very positive. With that, I just want to express my thanks one more time to the members of the media. We've said many times you've been an extension of the care team here. You have helped save lives, and you've helped release unbelievable, what would have been truly overwhelming pressure on the health system just by presenting information that's valuable to the public. And then to the members of the community that have supported us in so many ways, that support will never, ever be forgotten. So we're still available for individual interviews on this, but let's hope that it's one of our last COVID briefings for a long, long time, if not forever. All right. Thank you, everyone. Bye-bye. One more question if people are still on. At what point do you think you might drop mask mandates for visitors? Matt, I don't think there's a specific trigger. I'll pull Dr. Trapp up here, but with 30% plus of the state still unvaccinated, we have to continue to protect our workforce and our patients. So we'll be watching all kinds of things. But Dr. Trapp.
So Matt, great question. And we're going to continue to monitor rates per 100,000. Once we see within the community that those rates are significantly decreased, that's where I think we talk about reducing mask mandates for visitors. Again, this is within the healthcare system. And if you ask, why are we being so protective of wearing masks in the hospital, just understand that we're taking care of a vulnerable group of individuals who are hospitalized for other medical issues, some of these immunocompromised, some of these maybe kids who aren't vaccinated. So that's why we continue to recommend masks, and we're going to have a higher threshold to maintain that mask requirement until we see those community numbers and statewide numbers of rates of positivity of COVID significantly decrease. So more time, and I anticipate that as we release those, we're again going to probably release those in areas within the hospital, communal areas within the hospital, still maintaining some level of spacing. We'll see how that develops on certain select units where we may still require some masking, like in our NICU and other areas. So thank you.
Before we wrap up again, I would say the other thing too is as we've seen breakthroughs, we're just shy of 60% of our team being boosted. So there's going to be concerted efforts for boosting here. But boy, our team can't endure much more absentee from getting ill as well. So that's an additional factor in that. And then I would also add, if you haven't got your flu vaccine, please do, because that's another component. We've had masking requirements during flu season in the past, way before COVID, and we really don't want to see a spike in flu hospitalizations this year too. So that factors into it a little bit as well, Matt. Okay, I'm going to say thank you again. Thank you to members of the community and certainly people like you, Matt, Mark at KLIN, all of the over-the-air broadcast stations that you've been on these things religiously, and we're eternally grateful for that, and then the community support. So, gone. Okay, Jeff.